Hello everyone, myself Rinda Sadaqat. I have a bachelor's in dentistry and a master's in public health, and I am from my Aussie tutor, and I've been associated with the same since the past 1.5 years. And today we are going to begin our discussion about a very common nursing topic that is usually faced by students, which is clinical reasoning cycle. So let's begin. By which nurses and other clinicians collect cues, process information, come to an understanding of a patient problem or situation, plan and implement interventions, evaluate outcomes, and reflect on and learn from the entire process. So basically, clinical reasoning is defined as a process by which nurses, other healthcare professionals, clinicians, depending on the specific patient scenario, collect cues and process the information, come to an understanding of a patient problem, that is, they define a diagnosis, and then plan and implement interventions or actions that has to be taken to solve the patient problem and evaluate its outcome and reflect on and learn from the entire process. These are the various steps also of the clinical reasoning cycle. The benefits of having sound clinical reasoning include being able to make timely diagnosis for the patients, being able to actually prioritize the key issues that the patient is facing and then make prompt diagnosis and promote and provide prompt life-saving treatment plans as well, and avoiding any unnecessary investigations, which reduces the cost for the patient and ultimately improving the patient's health condition as well. So basically, clinical reasoning cycle helps us to immediately make a diagnosis or a timely diagnosis and effective diagnosis for a patient and its situation, and also apply prompt treatment plans and avoid unnecessary investigations, which reduces the cost for the patient and ultimately improve the patient's condition of health or health condition as well. So clinical reasoning cycle basically has a number of steps. It has 8 steps, and we are going to use a sample case study to be able to understand better how these steps are implemented and how the clinical reasoning cycle shapes out and helps us to treatment plan for patients. So, sample case study that we are pursuing today is that the scenario focuses on the care of an older person who experiences fluid and electrolyte imbalance and introduced to Mr. Cyril Smith and follow his journey from admission to day 3 post-op. Any alterations in his fluid status are common. Basically, post-op, any alteration in fluids is usually a common thing, and it manifests rapidly and can have potentially fatal consequences, particularly in the elderly patients with numerous comorbidities, which is the case of our patient today. Maintaining the delicate fluid balance and electrolyte equilibrium of post-op patients is an integral part of nursing care. Fluid imbalance can lead to significant morbidity and mortality. However, effective clinical reasoning skills will help you to recognize and manage patient deterioration early, thus preventing adverse patient outcomes. So basically, any effective clinical reasoning skills will help us to recognize the patient situation, and we will be able to come to a diagnosis to change the patient situation and apply steps to do the same. And then we are going to also be able to evaluate those outcomes and check if the patient is deteriorating or not and prevent any adverse patient outcomes as well. So the entire thing is a part of a component of a clinical reasoning cycle, where we are going to follow all these steps and reason out the issues that the patient is facing and come to a conclusion, a diagnosis, take steps to prevent or to act upon to provide treatment to the patient, and then evaluate if the treatment that we have provided or the action that we have taken is effective or not, and reflect on the entire exercise to help us build up for next cases or newer patients, or an entire medical science help or our nursing skill, clinical reasoning skill. So moving on, we are going to start with the first of the clinical reasoning cycle, which is the consideration of the patient situation. This is the phase where we are first presented with the entire case or the clinical case of the patient, where we receive the presenting information about the patient's current medical status. For example, if it is a newborn that is admitted in the NICU on account of neonatal jaundice, then that is the instance or that is the example that we take forward. Or if it is, for in this case that we are taking, that we have a patient, this is the morning handover report, which is the entire patient situation, the first step of our clinical reasoning cycle, which is to describe the patient situation that has been given to us. That is morning handover report. For instance, here we have Mr. Smith in room 2. He is 72 years old. He has bowel cancer and had a partial colectomy and formation of a colostomy. Patient's name, his age, gender, where is he located currently, his status, what is the disease that he has, current medical status, what is it that he is undergoing, and what is it that the reason that which he has come to the hospital. He is under Dr. NG, the doctor that he is under. His surgery was uneventful and he was stable throughout. He has a PCA, morphine and IV running at 84 ml per hour. Didn't have a good night though as his BP dropped, and has needed 2 fluid challenges of 300 ml each. This is the entire status of the patient that is currently there, with the history that has happened from the past 1 day, 2 days, 3 days, whatever the patient has been there in the hospital, and the current status of the patient as per this morning. He has an IDC on hourly measures, and these are still a bit low. Currently, what is he on? They're describing that. He has a Belovac and it has drained 300 ml since yesterday. Same thing, the thing that is there, and
what is the status of the same drainage? His wound has a dry dressing, it's intact, the wound status. He has a drainage bag over the stoma, no drainage. Oxygen therapy still at 6 liters a minute. He's tolerating the mask, his sacs are okay. The observations are due again at 800 hours. He is on 4th hours hourly BGS. Type 2 diabetic, diet controlled. Blood glucose levels are acceptable. He lives alone. This is the history. This is basically the current status, the current vitals of the patient. Then they start with the family. He lives alone. His current status of in personal life. His wife passed away a couple of years ago. Family situation. His daughter should be in later today. So all of the present presenting situation of the patient, his medical situation, his history, his current medical status, his vitals, and his family history. Everything has been described when you are considering the patient situation. Everything, the first step of the history of the clinical reasoning cycle is to consider the entire patient situation in its entirety, current medical status, personal information, presenting information, everything, so we can move ahead with what is happening with the patient right now. The next the cycle is collecting all the cues or all the clues. In this phase, you carefully consider the past medical history of the patient, the history of presenting complaints, sorry, the current treatment plan, any results of the investigations that have been done, and current vital signs. Then we analyze those findings using our established knowledge of physiology, pharmacology, pathology, culture, and ethics to establish cues and draw information from the same. So basically, we are going to look at now, we know the current situation, now we are going to look at the past medical history of the patient. Why, whatever he is complaining of presently, what is the history behind those complaints? What is the current treatment plan that is being followed for him? If there are any investigations that have been done, what have been the findings of the same? And what are the current vital signs? All of this you're going to correlate using your basic knowledge of physiology, pharma, pathology, culture, etc. to establish which finding investigation or which vital sign fluctuation is important in this case and is indicating what. So collecting all the important cues, which part of these, all of this information is vital to the present scenario or the present situation of the patient. That is what is basically collecting all the cues. So basically this step will require established knowledge or deep knowledge of physiology, pathophysiology, pharma, epidemiology, therapeutics, culture, context of care, ethics, law, etc., as well as an understanding of evidence-based practice as well. So for nursing students or for any students, this can be challenging because it requires not only a strong foundation but also the ability to synthesize and apply their knowledge to clinical situations, which are often complex and fluid. So basically, if you do this step, then you are being able to actually apply your basic concepts of physiology, pharma, pathology, etc. to a particular clinical scenario or case scenario and develop or take out an answer from the situation as per your current patient status. This can be a challenging work and this can be a big deal if your knowledge or if your basic ethics, basic fundamentals of physiology, pathology, pharmacology are not as strong as they should be, but it will also help you to develop practicing these clinical reasoning cycles and with case studies and cases will also help you to develop this deep knowledge, and then you'll be able to correlate all of it to different clinical scenarios and cases. So this step is a very crucial step which will help you develop your broad base also and be able to apply it to clinical situations. So after we have collected all the important cues from all the information that was provided relevant to the current situation of the patient, we move ahead to the next of the clinical reasoning cycle, which is the processing of this gathered information. It is a critical stage and it is a core of clinical reasoning where we are going to process all the data on the patient's current health status in relation to the pathophysiological and pharmacological patterns that he is presenting with. Whatever is relevant and how you can correlate those cues together and provide a basis, a pathophysiological basis of these changes of all the cues that you have collected. This processing of this information of all the critical cues that you have collected and how you can correlate all of it and determine a pathophysiology that is undergoing beneath all of the cues that are being presented by the patient. So this will help in processing all the gathered information. It is the most critical stage and the core of clinical reasoning where we are going to correlate the current health status, whatever is the important relevant cues that you have jotted down, to the underlying pathophysiology and pharmacology that is happening inside the patient. So for this case, you should know which details are relevant and determine potential outcomes for all the possible decisions you make. It is time to think about all the cues that we have collected about Mr. Smith's condition, make inferences based on our analysis and interpretation of those cues, his past history, surgery, signs and symptoms, our knowledge about fluid balance, all of this collection and processing of the gathered information and decide why this fluid imbalance is happening and how the pathophysiology behind this fluid imbalance is producing those symptoms that he is presenting with. So all of that processing of gathered information is what is the most critical and the crucial step and the core of clinical reasoning, which will help us to come to a specific nursing diagnosis or an identification of the problem that the patient is suffering from. So we can take steps ahead. step in the clue or in this series of clinical reasoning cycle is the identification of problems and issues. With the solid information processing phase, we will be able to determine the reason behind the patient's current state. At this stage, we will bring together and synthesize all of the facts that we have collected and inferences that we have made to make a definitive nursing diagnosis of Mr. Smith's main problems and issues. In this case, here they have given us several examples where we can find out and define a correct nursing diagnosis for Mr. Smith. As per the clues given, as per the case history given, as per the cues collected and the information processed, the patient is currently suffering from hypovolemia and dehydration. This is just a sample for you to help in determining or correcting and listing a correct diagnosis for a patient. This one is an example for you to know that it has to be a specific nursing diagnosis as per the situation of the patient. It could be any of it could be correct, but these are just samples and examples for you to understand the concept of defining a nursing diagnosis better. So this is how you're going to identify the problems and the issues. Moving on, we are going to establish goals based on the problem or the issue or the diagnosis that you have made. Here we are going to determine the treatment goals for the patient's situation. Treatment plans should not be open-ended and they should not be without any time-oriented goal. In fact, they should be close-ended, smart goals where you are specifically defining that is something that is measurable, attainable, time-oriented, and that can be translated or repeated anywhere. That is, we are going to specifically decide what is the desired outcome that we want for the patient to get to, so that his situation improves or his situation gets better. Before implementing any actions, we need to know why we are doing what we are doing and how is important it is to clearly specify what you want that should happen and when it should happen. What are the steps that you want to take and what is it that you're wanting to achieve by taking those steps. So first of all, you should know what is the treatment plan, how is it going to end with. It should not be open-ended, it should be a specific thing, a time-oriented goal. Again, here they have given us some important short-term goals with time management at this time that can be used as important clues or establishing goals for Mr. Smith's condition. In this case, it could be for Mr. Smith to be on normotensive patient with urine output less at least 30 to 40 ml per hour within the next 24 hours. This is the most appropriate and the most apt goal that can be established for Mr. Smith's condition, where he should become normotensive with urine output at least 30 to 40 ml per hour within the next 24 hours. So that goal should be established here in the first case for Mr. Smith, where the aim of the treatment or the final listing of the treatment has been established. The final aim of the treatment or the final goal of the treatment has been established specifically. That where he has to be normotensive with a urine output of at least 30 to 40 ml per hour within the next 24 hours. That is determining the patient's situation and how we are going to achieve this. The patient is hypotensive and dehydrated. We want to achieve this particular thing where we want to make the patient normotensive within the next 24 hours with a 30 to 40 ml per hour output of urine. So this is the goal or the aim that we have established. So between these two things, what are the steps that we have to take to be able to achieve that time-oriented specific goal of improving the patient's condition? That will be our next step where we are going to decide on the action plan that we are going to take to be able to achieve those goals. So the next step here in this case, in the clinical reasoning, is taking action. When we implement the action steps needed to meet the patient's treatment goals, it will of course involve other members of the healthcare team. So everyone should be updated about the treatment goals for the particular patient. This will basically involve determining the patient's treatment goals or aim that we have decided to implement for the patient, so we are able to make the patient normotensive and reduce or increase the urine output as per the desired number in the desired time frame. So this will not only involve nurses or doctors, but it will also involve other members of the healthcare team, for example physiologists or physicians apart from specialists. And also, if the patient is requiring, for example, if the patient requires physiotherapy or anything else, so we are going to include occupational therapists, physiotherapists and psychological counselors, etc. also as members of the healthcare team in order to help us achieve the goal, whatever that has been decided for the specific patient. The last step in the clinical reflective cycle is the evaluation of the effectiveness of the course of action that we have taken. It will basically be about deciding or being able to measure the outcome. In this case, we have decided that the patient should become normotensive within the next 24 hours. Whatever is a normal BP that is considered for the patient, we want to achieve that. And we also want to achieve a urine output of 30 to 40 ml per hour for the patient in the next 24 hours. So if we are able to achieve that, we are going to see if our line of action was correct that we were doing. And if the situation deteriorates or does not improve as per our expectation, then we are going to readjust and evaluate the current patient situation and readjust our plan of action to implement or apply for the patient and to achieve the desired outcome for the patient.
So I've understood the steps of the clinical reasoning cycle today, and I hope it helps us in building a clinical acumen and solving clinical cases accurately. Hope to see you another time again. Thank you.